bright and early day. I'm Dr. Amy Lisara Arirachakaran, an orthopedic surgeon, and today, starting from the moment I get up, I'm going to take you with me for a day in the life of an orthopedic surgeon during the COVID-19 pandemic. So now I'm done getting ready. I'm fully dressed in my hospital scrubs, so I'm going to head out now. Okay, so it's time for me to head off to work now. Are you going to be sad when I leave? Are you mad now? He just wants to leave. Okay, bye. I'll see you later. So I'm leaving the house now. Now with the COVID traffic, it takes me maybe 10-15 minutes to get to work. Still gotta hurry though, because they already called me. So when we get there, the first thing I normally do is go to the wards and check out the inpatients. I'm also on call of the ER today. Okay, so we've just arrived at the hospital. We just parked. So now I'm gonna put on my doctor's gown and my mask, and then I'm gonna go to the inpatient ward so I can see my patients. That's me. Okay, so now I'm here at the inpatient ward. Normally, the first thing we do in the day is come to the inpatient ward to take a look at our patients who are admitted. Okay, so now I'm going into the patient's room, so I'm going to have to ask you guys to wait here because you guys can't come in with me. Okay? Okay, so we're done here. The first day after surgery, we're doing really great. We've already started walking, and then now planning to discharge first thing tomorrow. Okay, so here we are at the 20th floor at the orthopedics department. We have orthopedics here, physical medicine and rehabilitation, as well as the spine center, and the counter where I work at, which is the sports medicine and joint center. So here we treat a whole plethora of conditions, including sports injuries, knee, shoulder, and hip problems. Okay, so now I'm heading over to my examination room, but on the way I always say hi to any colleagues who are sitting around here. So first, let's go see if Dr. Ritun is here.
Hi, Amy.
Oh, hi! So this is Dr. Ritun. So this is Dr. Ritun. He's also a sports medicine surgeon like me, but he's double board certified. He's also certified in hand and elbow surgery. So we always work together as a team. We're having surgery together later tonight, right, Dr. Ritun?
ไว้มีโอกาสได้เจอกันนะ
So if you have any pain in your shoulder, hips, knees, hand, and elbow, you can always come and see Dr. Ritun. Are we right? Okay, I'll see you later on tonight. สวัสดีค่ะอาจารย์ So I'm going to consult a surgery case with Dr. Rishan, the head of the center now. Can I please consult the case?
Yes, come on.
So now I'd like you to meet the head of our sports medicine and joint center, Dr. Rishan Ganjanatawan. He's also my professor and the head of our center here. Dr. Rishan, I'd like to consult this case. It's a patient with a rotator cuff tear, and the clinical symptoms have been going on for several months already with severe pain.
Okay, so look at the MRI is obvious with the cuff tear that absolute indication for surgery. So I agree with you, Pat, that this patient needs to have surgery done. Okay, I agree.
Okay, so I'll go set the OR. So the reason that everyone in the team is so important is because here, when we work as a team, whether we do surgeries or whether we do patient care, we work as a team, just like in Grey's Anatomy, when you see all the doctors in the OR at the same time. In real life here, it's like that too. So I'm glad that you can meet our entire team today. This is my examination room where I see all of my patients. Everything here is on an online system in order to decrease our paper trail and make information accessible within the hospital. So this way, I can look at patient MRIs or x-rays anywhere in the hospital as long as there's a computer.
สวัสดีลิซ่า
Okay everyone, so this is Dr. Charlie. He's an arthroplasty specialist in our center.
สรุปแล้วเคสเป็นไงบ้างเอมี่โอเค
ฝีมืออาจารย์สุดยอดค่ะ Okay, I'll see you later, Dr. Charlie. Bye. ค่ะคนไข้มาแล้วค่ะโอเคได้เดี๋ยวเอาเข้ามาเลยนะคะ Okay, so now my patient's here, so I'm going to see my patient first, and I'll see you guys right after. Oh, that's me. So this is one of our videos in the exercise series that we did for the Sport Medicine and Joint Center, which is actually an exercise program that we use for patients to do physical therapy. So yeah, that's me on the screen here. So now I'm here at the ER, the emergency room. I had a consult for a fracture case, so I'm going to go in and see whether the patient needs a cast, immobilization, or whether the patient needs surgery. So when we come to the ER, we have to wear full protection. So I'm wearing an apron, a hat, and an N95 because we have to treat everyone like they may be a suspected COVID case because now you never know with the pandemic. I'm going to go inside now, okay? Okay, so here we are at the Sports Medicine and Joint Exercise Center, which is a center where we do physical therapy that's exercise-based. So here we have a specialist, Dr. Suti, who helps us with the rehab of all our patients. So, hi, Dr. Suti, nice to see you today.
How are you?
Good. So Dr. Suti, he's a physical medicine and rehabilitation doctor specializing in sports medicine, in particular office syndrome, and he helps us with the rehab of the exercise programs that we do for our patients who are undergoing physical therapy.
I take care for many patients, especially in the field of sports injury. Patient after treatment, such as surgery or non-surgery treatment, they will come here to do the exercise to build up the muscle, prepare them to go back to do the sports activities.
Okay, so now that you've seen what we do here at the Sports Medicine Joint Exercise Center, I'm going to head off to the OR now and I'm going to leave this to Dr. Suti. So Dr. Suti, thank you so much for having us here today. So I'll let you get back to your work then. Okay, bye. So now we're washing our hands. The hand washing technique, it's more than 6 steps. It's 9 steps because it's a surgical hand washing technique. The reason we're wearing these protective equipment is to protect us from the radiation. So we're all wearing this. And these thing is here so that we can wear protective equipment over our head to help protect us getting COVID from anyone. Okay, so now we're done washing our hands. We're gonna go in. See you later. Okay, so it's 11 p.m. We just finished our OR. I'm gonna head home now. So I hope you enjoyed a day in the life of an orthopedic surgeon during the COVID-19 pandemic. Bye! If you liked what you saw today, then please click like and subscribe and share, and please comment below on anything else you'd like to see. Bye!